a 2-month-old baby that's born by C-section, and this baby likes extension. Now, when we talk about extension babies, we have to be careful here, because are we talking about extension in the spine, or are we talking about extension in the cranial mechanism? And in here, in this video, we're going to talk about extension in the spine, and we're going to leave for another day these cranial extension babies where they have these narrow cranium and the cranial system is shut down into this extension pattern. Here we're talking about in the spinal cord. So this baby likes extension, and so much so that they've actually rolled over quite early because they were in this extended pattern, and you see these babies roll over. So in this expansion pattern, why would a baby have this? Because it's important to try and work that out, because it helps us work out what we're going to do for this baby. And so when I think about this is based on my clinical experience. There isn't any evidence-based medicine I have for this, any studies or research, just to be clear on that. This is based on clinical experience, me trying to think, well, what is happening? If we think about meningitis, and if we think about when the dura and the meninges tighten, what happened? So if you go and Google, because I've never seen a child with meningitis, but if you go and Google meningitis and you look at images of a baby in meningitis, because you'll hear about tight neck and rash, you'll hear that. But what is that tight neck? Now, if you dig into that, what you'll see is the tight neck is like this. It's this real extension in the neck. Now, if I apply that to my own body, because what I like to do is you take theory and you look at different things, and then how does it feel in my body? So I'm getting a bit older now, and I'm in my 50s, and so my flexibility is quite poor. And so when I do stretches, I have a lot of difficulty mobilizing my back and stretching everything out. And when I try to, because I'm not great with my stretch, I don't do them regularly, when I try and go do it after I haven't done it 4 or 5 days, I'm obviously trying to do the same stretch I did before, and so I might bring my knees up or bring my hands in and try and lie on my back, try and bring my feet up. And so that stretch that I'm getting all the way through the back, yes, it's a lovely stretch, but as I push it too much, I've really noticed that my head goes into extension. So my back is on the floor here, my hips are up, my knees are up, and this neck goes into extension. And so my neck is having to give the spinal column the stretch. There isn't enough flexibility in my meninges, in my dura, to do what I'm asking them of. And this is what happens in these babies. And so you can actually practice this for yourself and experience it. Put yourself under a strong stretch, unless you're one of these mega flexible people, it might not work for you. Put yourself under a strong stretch and see what happens when you're lying down to that neck, and see what's happening where you're creating slack in the system. And so these babies that are like extension, what they're trying to do is create in slack in their dura and their meninges, because there's not enough slack in those areas. Now the alternative when I think about this is, well, what else could be tight? Maybe we're going into extension because the muscles are tight and the rectus spina are tight. Well, maybe or maybe not, but why would a baby be tight in that area? Generally speaking, in utero, they'll go into this flex position. So it's not like it's in utero position. Perhaps it could be, they could be extended, but, I think that would be more rare. Also, in terms of, as a baby, there isn't anything that would do that. They're not doing heavy lifting, obviously, or anything like that, that will give us tight muscles that we might experience as an adult. And so I really, from my mind, clinically, it pointed at the dura and the meninges. And so when I treat that, that's why my focus is the meninges and the dura. And then I've actually got very good results with these babies. So it kind of reinforces the model that I'm thinking of here. So I may not fully understand it. I'm more than happy for anyone to comment and say, hey, there's a hole in that. What about that? And we can nut this out and maybe take it a bit further and explore and, improve this model of what I'm thinking of. And so what you'll see with these babies is that if we come on now to the clinical application of this, you'll see them, you do this extension pattern, but they're also the babies that when you go to put them on, you give them a nice cuddle. Some babies just snuggle into you and they're like, oh, that's really nice. Well, these babies are kind of like, they don't really like that. And you turn them around and face them outwards, they're like, oh, that's better, because they kind of extend back over you. And if you move them up a little bit and let their head drop over your shoulder, they're like, oh, that's nice, that's nice. And there's various extents that can happen. It happens a little bit, or it can happen to a huge amount. But if you get those babies, just think of that dura, that meninges, and allow them to go more into that extension pattern. So that might be as they're lying on the table there, put your arms up and let them go. Put your hands up under their thorax, under their back, support them, and let them drop into extension with the weight of that head. And then they might ease out. And if they do, it's like, aha. this is definitely extension baby. So you want to encourage that to give you slack in the system, which will then allow you to work in that nervous system, get into that shock a little bit, because often you can get shock in the system causing that dura and that meningeal tightness. And then as you start to get more slack in that area, slack in that system, then you might be able to bring them back the other way and get them into flexion a little bit more, which might be, a mechanical structural treatment, or you might use other kind of functional techniques or cranial techniques, whatever, whatever work you try to, whatever techniques you tend to use it. But getting them into that extension pattern and getting them to move nicely into the start with is really useful and really helpful. And of course, while you're doing that, you want to have your focus, your attention on that dura and on those meninges, and just imagine those structures. So get an anatomy book out, look at the meninges, look at the dura, think about, right, okay, and what would happen to the cranium, what would happen to the spine, what would happen to the sciatic nerves, everything if that was tight. And so you're getting yourself in and you're focusing on that. Babies are incredibly responsive, and if you attune yourself to those tissues respond. With the exception that you go, oh, I'm attuned to those tissues, I know what those tissues want, I'm going to make those tissues normal. That's an absolute disaster with most patients, but particularly babies. So if you think, right, this baby's, dura's like this, I'm going to make their dura like that. No, that's not going to work. You're going to have to acknowledge what's going on for the baby. The baby is trying to get the dura into a particular position. It's trying to shorten it because of that contraction. They're trying to do this pattern. So we're going to let them do that pattern to the point, the exaggeration, to that point where the baby goes, oh, I feel acknowledged, I feel happy, I feel some kind of relief that somebody is listening to my tissues. You're providing a fulcrum for those tissues. And then if the body allows you, you listen to those tissues, then sometimes what will happen, it will go back the other way and you can get the change that you want in terms of that. This is doing this and I wanted to do that. Sometimes, however, you can't do that. You just have to acknowledge, and then what happens is the gap between the treatment, between this treatment and when you see the baby's neck, that is when the magic happens. You set up the pattern, you set up the acknowledgement, and then it changes. It's just like a conversation. You have a conversation with someone, you acknowledge what's going on for them, you're hoping that you can let them see a different angle of what's going on. You acknowledge first, maybe just show them a different angle on that, but you don't shove it down their throat. You just leave it, and then they may or may not accept that change and see it from a different angle, and then we get this change in perspective, we get this change in the energy, we get this beautiful change. Happens in conversations when we are able to be quiet enough and able to see the other person's point of view and not ram it down the throat, and it definitely happens in terms of babies, in terms of treatment. So I hope this has been of great use to you and has inspired you to think about this topic. Really think into what you're doing with your patients, and it will really lead you to riches and lead you to explore your own talent. That's why we're doing these things, to bounce back off each other. So do come back to me and go, hey, I found this, or look, I found that. I don't think it matches what you say. I'd love to have conversations about that. I have no way claiming I have the answers. It's just, I just like exploring this art that we have and trying to put my talent out in the world, and I just encourage you to do the same.